Can everybody see my screen?
Yes.
Lovely. Lovely. We'll go ahead and get started. Thank you all for joining. Welcome to UC Irvine's Older Adult Health Education Tele-Echo series, presented in partnership with Meals on Wheels, California. It's our pleasure to be here with you today in the first of our four-part series. The structure of these sessions will follow the ECHO model with a brief welcome and announcements, followed by a 30-minute didactic presentation. This will be followed by a case presentation and collaborative discussion. And we will then close the session with a few reminders. As a courtesy to others, please remember to mute yourself when not speaking to prevent background noise. We are recording the session today, so please accept that invitation when it does pop up on your screen. When speaking, please introduce yourself with your name and location, and also please remember to maintain confidentiality when speaking about your clients and refrain from including any identifying information. And of course, respect others and their opinions. Our session today is approved by the California Board of Registered Nurses for continuing education credits, if that's of interest to you. A certificate will be sent to your email and file at the conclusion of our series. Please complete the CE form at the end of each session, and this will be sent to you by email, but also noted on a QR code at the end of our presentation. I did want to take a moment and review our ECHO session structure and really the background of ECHO sessions. And this is just to remind everybody of the format. So this is a format of training that Dr. Sanjeev Arora actually created when he started Project ECHO in 2003. And he did this at the University of New Mexico because he wanted to reach more people than he could through one-on-one clinic evaluations. And his focus was hepatitis C. So he developed a hub and spoke model where the hub team, which is what we are today from UCI, has information and expertise in a certain area, and they provide that information to spokes, such as you all, who have an interest in our area caring for older adults. And through Dr. Arora's hub and spoke model, hundreds and thousands of folks around the world have been touched on a variety of different topics. So as you can see by our diagram here, this is a collaborative and integrative learning model consisting of our hub team and our spokes, which is, we will have a brief didactic. And then the most important part, of course, is our case discussion at the end. We are very informal and we want this session to be as meaningful for you all as possible. So please don't hesitate to ask us questions by unmuting yourself as we go through or putting questions in the chat. Our presentation today in our ECHO series is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. This information or content and conclusions are those of the author and should not be construed as the official position or policy of HRSA, HHS, or the U.S. government. Before we get started into our formal didactic portion of our presentation, it would be wonderful if we could all take a moment and introduce ourselves. Just given the nature of our setup today, for those of you who are joining us, if you could please put your name and your role and location in the chat, we would truly appreciate it. And we'll take a moment and introduce our team today. So our hub team from UC Irvine is consisted of myself and Dr. Lisa Gibbs, and I'll go ahead and introduce myself first. I'm a clinical professor in the Department of Medicine and Division of Geriatric Medicine and Gerontology here at UC Irvine. And my clinical practice site is in Orange and in Laguna Hills, California. And it's really my pleasure to be here with you today. Let me see if we have a few other members of our team that have joined us. Actually, yes, Dr. Julie Rousseau is on the line. Dr. Rousseau, would you like to introduce yourself?
Absolutely. Hello, everyone, and thanks for joining us today. Hi, my name is Julie Rousseau, and I work in the Division of Geriatrics. I am a nurse, and I work with a lot of community outreach and education, and thank you all for your time and joining us today.
Thank you, Dr. Rousseau. We have a few folks who have introduced themselves on the chat, and I'll just go ahead and mention a few. We have Lois, who is a social worker with Meals on Wheels San Francisco, Christy also from San Francisco, Emin from Sacramento, and Joe Garza from Orange County, Laura from San Francisco, Rita and Jeff from Meals on Wheels, California. Thank you all for joining. And Patty Mouton from Alzheimer's OC. Thank you all for joining. I'll go ahead and introduce our topic today. Today we're talking about COVID-19, mutations, mitigation, and medications. And really the focus today is staying safe while caring for others. And there's been a lot of information and a lot of change that has come about in regard to our strategy for COVID-19 management. And I wanted to take a moment during this presentation to acknowledge that, but also to provide you with some updates on how we should be thinking about COVID-19, considering so much has changed over even just the last few months. So my focus today is going to be to review where we are currently in the pandemic, and certainly that has changed, and what has changed about our knowledge and thinking of COVID-19, and how we can use the tools that we have to stay safe while providing care for our clients and patients. And I'll first review the current state of the pandemic around the world and in California, and then I'll talk about the virus and how our knowledge of it and how the virus itself has changed from 2020 and what implication that has for us. And then I'll review a few easy things to keep in mind when working with clients and patients and being around others to help them and us stay safe. And I'll then briefly review some of our management and treatment strategies that everyone should know about and be able to advocate for themselves or for their clients. So first of all, I think we're all familiar with COVID-19. And this has become, very common vocabulary over the last 2 years. And of course, we are very familiar with the symptoms of COVID-19. I did want to highlight here's the overlap of symptoms between the common cold, a flu, and COVID-19. So back in 2020, when COVID first emerged, patients were experiencing very severe symptoms. There was a lot of shortness of breath, high fever. People were unfortunately being hospitalized at high rates, and there were a number of folks that ended up needing artificial ventilation, sort of breathing machines because they were going into respiratory failure, quite frankly. And although we are seeing some of that now, the virus, due to changes in the virus, structure and pathology, and due to vaccines and treatments, we are seeing a lot less of that, thankfully, but we are seeing a change in the symptoms. And so now it is very common for patients to come in complaining of fever, chills, muscle pain, sore throat, a runny nose, and maybe even a little GI distress. And the symptoms overlap quite significantly with the common flu and a cold. And so often patients and people don't realize that they actually have been infected with COVID-19 or that they may have COVID-19 because the symptoms are so mild. But really important to keep in mind that if you are working with a client or patient, to even be aware of these very mild symptoms. Now, you might wonder if the symptoms nowadays are so mild and we are not seeing the hospitalization rates and severe disease rates that we were seeing back in 2020, why should we really worry about COVID? I mean, COVID's over. People are telling us COVID is over. We can move on and the pandemic is over. But really, why should we continue to be vigilant and continue to remind ourselves of mitigation strategies? Well, there's a lot of information coming out right now about long COVID and these long-term effects of COVID-19 infection. And this is what frankly makes COVID-19 and the SARS-CoV-2 virus different than the common cold and even influenza. So we're now learning that about a third of the people that survived COVID illness have some kind of lasting effect. And although most people get better within a week to a month of illness, some don't. And these long-term effects can last anywhere from 6 months to a year and beyond. And we don't really know why at this point, why people are experiencing this post-COVID illness. The long COVID symptoms can range, again, from 6 months to a year out, and they are pretty broad in terms of the symptomatology. So people are describing profound fatigue. They are describing cognitive changes where they're having difficulty thinking and concentrating and feeling like they're in a persistent brain fog. There was a research article that looked at brain tissue, and they found changes that looked like a brain had aged about 20 years after infection with COVID-19. So these are all very concerning long symptoms. People are also experiencing persistent chest pain, difficulty breathing, myalgias or muscle pain, joint pain, some mood changes, a lot of anxiety, and a lot of cardiac complaints as well. So people with persistent and unexplained rapid heartbeat or inability to maintain their blood pressure even. And research is ongoing and very active to try to determine what the cause is. We don't know whether this is persistent virus in the body that never leaves or some kind of inflammation and activation in the body's own pathway that turns pathologic. So again, I think at this point in time, we know a lot about the virus, and we have some knowledge about treatment strategies and mitigation. We don't know a lot about post-COVID. And so that is really one strong reason why we should all be concerned and be on the lookout for prevention. And of course, I think people are familiar with the MIS-C, which is this multi-organ effect, which affects children. So children who generally have better outcomes and much more mild disease can also have post-COVID effects as well. Now, the one interesting thing about post-COVID or long COVID symptomatology is it is not occurring only in people that have had severe disease. It is happening to people that have very mild illness, and some people that have had such mild illness they didn't even realize they were infected with COVID. So, so something to just keep in mind. This is not a condition of only the severely impacted from the SARS-CoV-2 virus. So now that we know the rationale for why we should remain vigilant and remain informed, I did want to focus on 5 things that we can all do to stay safe while caring for others. And the first thing that we should focus on is knowing our numbers, and that's really understanding our community and what's happening with transmission in our community. We'll then talk about scanning our environment, and that's the very immediate environment in which we are interacting with somebody, whether it be through a home visit or an office visit. We'll talk about protection strategies, we'll talk about testing and treatment, and then of course, overlying all of this is our advocacy work to keep ourselves and others and the vulnerable safe. So let's move on and talk about knowing our numbers. And of course, this refers to COVID transmission rates in our community. And this has changed quite a bit over the last month to 2 months. And so this sort of busy slide here is looking at cases in California. So these are California data that I actually pulled just yesterday. And you can see here that in California, we've had 8.6 million confirmed cases. That's likely much higher due to availability of home testing now and unreported cases. And unfortunately, we've lost almost 90,000 folks to COVID-19. And if you look at the x-axis of this graph here, so it starts in March of 2020 and it goes all the way through March and April of 2022. And you can see that, you can see our initial peak here in California was the summer of 2020. We then peaked again in the winter of 21. We then surged again late summer. And then we had our most recent very high Omicron peak in January of this year. So you can see all of the surges that we've had here in California. And let's do a little bit more of a deep dive. So we know that right now in California, levels of the virus or cases are actually pretty low comparatively. You can see that we are starting to uptrend just a little bit, so very, very slightly. You can actually look even further and see, again, this is data that I pulled yesterday, that across the country, so what's happening in the United States, you can see that cases are starting to go up and hospitalizations here are starting to go up, but thankfully we are not seeing yet an uptrend in people passing away from COVID. Now, this kind of data is readily available for you online, but I think the most helpful information is actually here when we get down into our county level data. So I live in Orange County, our university and hospital is in Orange County, and the New York Times gives you a free access to county level data. The CDC does this as well, and you can plug in where you live and see what's happening. And in my county here, you can see that our cases per 100,000 is actually pretty low, but we have had a 65% increase over the last 2 weeks in the number of cases. So our cases here where I live are uptrending. Now, this is important because if a client or a patient tells me that they want to travel to Hawaii, sometimes I'll plug in and look at what's happening in a patient or client's destination, and you can see Hawaii really has had a big jump over the last 2 weeks in their cases. So this kind of data here is helpful. It's helpful to understand what's happening on a local level. If transmission levels are very high, and I'm going to do a home visit or meet with a client, I might take more precaution than I would if cases are low. And that's how I would interpret this data. For more information, the CDC does tier community level transmission, low, medium, and high. The majority of the country right now is in the low level of transmission, although we are seeing certain parts of the Northeast, for example, move into higher levels of transmission. And you can see here that, depending on where you are, if you're in the highest levels per the CDC, they then recommend more strategies for protection. So masking, vaccinations, and testing much more aggressively. It's also important to put all of this in context of your risk factors or your client or patient's risk factors. So if someone is young and healthy and has no chronic conditions, the risk to them of severe COVID is obviously less. Most of my patients in geriatric medicine have one or more risk factors. And so I do want to be cautious when I'm around someone and I know and I understand what those risk factors are. Some of the risk factors are actually surprising. So, of course, age over 65, of course, diabetes or kidney disease, asthma or COPD. But even if someone is slightly overweight or they fall into a slightly elevated BMI, there is an increased risk. Patients with dementia, of course, disability. We've seen a lot of complications and adverse effect in pregnant women. So if you are interacting with somebody who is a female who is pregnant and maybe unvaccinated, that's a particularly high risk group. I was surprised by physical inactivity as being a risk factor. But certainly there are a lot of conditions here that do put people at increased risk for adverse event. So know your environment, know transmission levels, lots of free online tools for you to utilize. I think my favorite is the New York Times. Data, you can plug in your location and any location that you're interested in tracking. Let's move on and talk about let's focus on number 2, which is knowing your environment. So knowing your very, very, very immediate environment. So at the start of the pandemic, we were not sure how the coronavirus was transmitted. We spent a lot of time sanitizing our hands. At one point you couldn't find hand sanitizer, you couldn't find bleach wipes. We were bleaching down our groceries. And thankfully, we don't need to do that anymore. We know how this virus is transmitted from person to person. It is not by surface transmission. So it's obviously good for hygiene purposes to wash hands and keep our surfaces clean, but really this is a virus that is transmitted through air. We know that this is an aerosolized virus. People expel this virus as they're talking, as they're breathing, and as they are coughing. And as this picture sort of demonstrates with these little blue dots everywhere, this virus will hang out in the air. It will be suspended in the air, as some studies show, for up to at least a few hours, particularly in poorly ventilated areas. So ventilation is key, and there's a lot of talk in the environmental literature and medical literature, and even in sort of regulatory literature about what we should do to improve ventilation so that we can minimize the risk of acquiring COVID-19. So really important to look at the environment. So if I'm performing a home visit on a vulnerable individual, I certainly would not want to transmit unknowingly any virus particle that I might be harboring. And so really looking at ventilation, opening a window, making sure that the ceiling fans, if available, are on. If they have air conditioning, making sure that's on. There are portable air cleaners people can purchase and have in their home. And really looking at good ventilation. So the more windows that are open, the more air you have flowing, and the more air exchange, the safer you are. And there's a lot of talk about this for folks that fly a lot. The airplanes have really great ventilation and air exchange, which makes the risk of acquiring COVID-19 in flight much less than when we are, say, in a building somewhere. So these are things to think about in someone's home, in a particularly busy venue, or in an elevator, say, something like that. I've had a few patients, I've had 3 actually, just this week tell me that they were involved in a indoors. These are 3 separate events and 3 separate locations, but these 3 people attended weddings indoors, not a lot of ventilation, and unfortunately, all 3 acquired COVID this past weekend. Now, one thing about ventilation I find very fascinating is that, and you all know that this virus has morphed, right? We now are on Omicron. We had Delta before that, and we had some other strain before that. And as this virus mutates, it becomes more and more contagious. And the current version of the virus that we have now, Omicron, is thought to be 30% more infectious than our original strain. And we don't know if that's because people who are infected with Omicron actually spew out more virus particle. And so there's more density of this virus in the air. So more information to come on ventilation, but something always to keep in mind. So our immediate environment. So number 3, so let's kind of review available protection and preventive items that we have. What can we do to prevent from being infected? So of course, as I mentioned before, we've had, at least 5, if not more, variants of the coronavirus. We started off with the original coronavirus that came out of Wuhan, China, that very quickly morphed into Alpha, then Beta, then Gamma, Delta, and now Omicron. And we're on we're on BA 2.12.1 now. And what we know is that viruses mutate, not just the coronavirus, but all viruses mutate. These mutations occur randomly, and they occur, and the ones that survive occur because they have some sort of survival advantage. There's something that allows this virus to stay around, to infect more people so that it can propagate. And we know that, or it's thought that this BA 2.12 is now going to overtake all strains that we have floating around in the United States now. And every time there's a new variant, scientists get very excited because they need to figure out, is it more infectious or less infectious than before? And is it more severe than before? And as of right now, so far, we've been lucky in that each strain has been less severe and less likely to cause medical problems, but we don't know if that trend will continue. So we're always on the lookout for that. In terms of protection, really one of the only things we have to prevent getting an infection is using a good quality mask. At the beginning of the pandemic, there was a lot of information out about using a cloth mask, that was appropriate for a variety of reasons, probably supply chain issues, lack of knowledge that the virus was aerosolized. But we now know that the better quality masks really filter out the tiniest of the tiny particles. So of course the N95, I think this has become standard vocabulary in our country now. The N95 is the best, and then better or a little bit less than that is the KF94 or KN95, and then a little bit less protective is a surgical mask. We really do, at least for me, I do advocate my patients, particularly for those who have any kind of a risk factor, to move away from the cloth mask. If they don't have access to a better or best quality mask, to at least double mask with a cloth and surgical mask to protect themselves. This virus, this Omicron, is just too contagious to use a cloth mask alone. And my patients have been sharing with me that there are good quality N95s available for free at local pharmacies. that were provided by the government for distribution. So hopefully that will continue. And fit is important. So if you are going to wear a surgical mask with a cloth mask on top, just or whatever mask you wear, make sure that it does have a snug fit around your face, so that it shouldn't be tight, it shouldn't be uncomfortable, it should just be snug to protect you. Now, let's talk a little bit about vaccines. So vaccines have been really a godsend for this virus, and really to protect the world against serious complications from COVID-19. And while initially we thought vaccines would prevent infection, we now know that that's not the case. This virus is too quick to mutate, it is too infectious, and it is really hard to prevent infection, respiratory infection, from vaccines. So really, the goal of vaccine administration is to prevent death and serious complications and hospitalization. So it is not a failure of the vaccine if you are fully vaccinated and even boosted. If you get a mild case of COVID-19, right? It's the vaccine doing its job. It's protected you from requiring hospitalization or needing ventilator support. Many of my patients are concerned about the safety of vaccination. Some are hesitant to be boosted due to safety, but it's really astounding. We've given 11.6 billion doses of COVID-19 vaccine around the world. There's almost 5 billion people that are fully vaccinated, and we're seeing very, very, very few complications related to vaccine administration as compared to infection. So even though Omicron seems to be less severe, we don't know that it's truly less severe in the unvaccinated. There is some research to suggest that it is as severe as our original COVID virus in the unvaccinated. And the majority of our hospitalizations and ventilated patients right now are unvaccinated. I think everyone knows this, but just as a reminder, we do have 3 FDA vaccines who have been granted EUA, or emergency use authorization. There's the Pfizer, Moderna, and J&J, or the Johnson & Johnson. Just yesterday, the FDA announced a change to the recommendation for the Johnson & Johnson vaccine. They are no longer recommending it for the general public due to concerns with blood clots. So they really are moving more to using Pfizer or Moderna. And for people that have a serious allergic reaction, they can then consider Johnson & Johnson. Both the Pfizer and Moderna are incredibly, incredibly protective against severe disease and death. They are safe, and as you can see here, the protection with these vaccines is higher in the older age groups. So in February of this year, studies compared a fully vaccinated person in each group shown below, and the monthly rates of COVID-associated hospitalizations, and the benefit was highest in people over 65. There's still benefit in people who are between the ages of 18 and 50 and 50 and 64, but really high benefit in folks over 65. So we really do want to advocate for vaccination. This is just another graph that shows hospitalization by people who are fully vaccinated, boosted, or unvaccinated. And you can see in the orange line that for those folks who are unvaccinated, significantly higher rates of hospitalization. And you can see that in the light blue line, those are people who are fully vaccinated, and the dark blue line as well. You can see that there's significant benefit there. Recently, so we did several months ago receive notice from the FDA and CDC that there was a recommendation for 1 additional booster after the 2-dose series of the mRNA vaccine, so either Pfizer or Moderna, and it was recommended that everyone over the age of 12 receive a booster, and that was because there was some information at the time showing that vaccine efficacy did wane over time. Our immune system is very complicated. There's actually two different features of our immune system. There's immediate protection with antibody, and then there are memory cells that get reactivated after months and months of having been vaccinated. And what we know now is that even the 2-dose series, certainly better if you've had one booster shot, does protect you many, many months out from severe disease and death. So it is recommended that you have 2 shots and then 1 booster shot. And there's some discussion among scientists about whether the initial series should have been 3 shots instead of 2. It's just that science had to move very quickly to get these vaccines out to protect folks, and they couldn't make that determination. But time will tell. Recently, there's been a recommendation for a second booster shot for a very specific group of people. So for people who are over 50 or moderate to severely immune compromised. And there's been some recognition that if you are an immune compromised individual or are taking medications that significantly suppress your immune system, that the vaccines, the 3 doses that you've had before simply may not be effective. And I personally have had 3 patients with rheumatoid arthritis who are on immune suppressant medications, and they were tested to see if the vaccine had mounted a reaction, and they had 0. They had 0 antibody protection from the 3 shots that they had received before. And 1 person, unfortunately, succumbed to COVID-19 despite having 3 vaccines. So there is some recognition that for some people, there is an additional shot that is needed to get some level of protection from the vaccine. Now, I think time will tell. This is kind of a soft recommendation right now. You're not seeing a ton on TV or in the press about really pushing to get a second booster. The FDA and associated groups are meeting this June to decide whether we should push the second booster shot dose, or whether there'll be another shot in the fall, which will include Omicron specific material to really protect us against Omicron. We don't know yet what will come from that meeting. Personally, if I have patients who are immune compromised or over the age of 65, I do really talk to them about getting a second booster shot, and we really analyze each patient's individual risk. So if they're traveling to an area of high risk, of high transmission, they're going to be participating in a wedding, an event, I do recommend that they get the second shot. And then other people who are at lower risk, maybe we wait a little bit, but that's kind of a decision on an individual basis. So again, I just want to really emphasize, so vaccines super important, not going to prevent you from getting COVID. The only thing that can prevent you from getting COVID is, wearing a good mask and staying at a distance from people, but that's not realistic all the time. But the vaccines can prevent you from severe disease and death. Let's move on and talk about item number 4, which is treatment, and really getting early treatment on board. So this is a slide I pulled, interestingly, from the Arkansas website on COVID-19, and I thought they just did a very nice summary of the available treatment options. And this is so exciting. We've waited for so long to be able to offer patients some kind of medication, whether it be infusion or pill, that can reduce the risk of complications from COVID-19. I think we're all familiar with the term monoclonal antibody infusion. It's something that we used in the hospital for severely ill patients, but now we can actually give it to people with moderate disease who are at high risk for developing complications. We can actually infuse it in the outpatient setting. Many large health centers do have that available. So for folks who do become ill, test positive, we can advocate that they have this infusion. It's pretty remarkable, the turnaround that people do experience. I had someone just get the infusion on Monday, and he went from feeling very, very poorly to within 48 hours feeling like a whole new person. So it was quite remarkable. Even more interesting, I think, and hopeful are the oral antiviral treatments. So these are medications like Tamiflu that we have for influenza. And these are pills that we can take. The most effective one right now is called Paxlovid, and we can use this to treat mild to moderate COVID-19 in adults. There are two different medications. There's molnupiravir and Paxlovid. Paxlovid is more effective overall, but it does have more drug-drug interactions. So it is something that you have to discuss with your medical provider. But these are, I think what I was reading yesterday, they reduce severe disease or severe complications by almost 90%. So it's pretty remarkable. You do have to start these treatments within 5 days of symptom onset. So it's important to get tested and treated, tested and then advocate for treatments early. And there's lots of anecdotal information coming out where people are having a difficult time accessing Paxlovid. Providers are not really sure about when or how to prescribe it, which pharmacies have it. But there are websites online where you can actually see which pharmacies have the drug available. And there's lots of information for prescribers as well. So hopefully that along with supply will catch up to need. And then we have a product called Evusheld, which is pre-exposure treatment. So for people that are severely immune compromised, my patients with rheumatoid arthritis on heavy immune suppressant medications, people who are have bone marrow failures and their bone marrow is not able to mount a response, we do have pre-exposure treatments that can protect people for up to 6 months from COVID-19. So really exciting developments in regard to pharmaceutical therapies for COVID-19. We are all familiar with testing, lots around about PCR testing, rapid antigen or home testing. They're both good. Thankfully, the government has provided a small amount of home tests for free. Hopefully that will continue. And I think patients should just be aware that, test when, if it even comes into your mind, go ahead and test and be safe. And then report the results to your medical provider for a discussion about possible therapy. We are seeing a delay in test positivity with rapid antigen testing. So people who are now vaccinated, they may develop, if they do come down with COVID, they may have very mild symptoms on day 1 and 2. And we're finding that rapid antigen testing doesn't always turn positive right away. And so you may have to test again 24 or 48 hours later to really confirm the test positivity. So we recommend that if you're symptomatic and your initial test is negative, that you do test again 1 or 2 days later to really confirm that. So lots of information. I know that I've presented in regard to COVID. Finally, I'm presenting this information because I want all of us to be informed and advocate for those who need assistance accessing therapeutics, accessing testing, and really to provide a framework for how to assess our personal and clients' risk for COVID. I think there's a lot of hope right now in our society. I'm hoping that cases will continue to decrease and not rise any further, at least not have any steep elevations in COVID cases. We are seeing a decrease in hospitalizations, and I'm hopeful that that will continue with good therapeutics and access to these medications. And I'm hoping that the decrease in overall death from COVID will continue as well. But we should advocate strongly for use of these products, these medical products. So I know that was a whirlwind kind of experience on COVID. I did want to leave you with this website. This is the cdc.gov, where you can find the latest information and updates and recommendations regarding COVID. They do get down into county level data, so I do find that pretty helpful. So take a look at that, and I will end it here and open it up for questions if anyone has any. All COVID experts. I'm thrilled. If no one has any questions, we'll go ahead and move on. and move right on into our case presentation. And I am very, very thankful